Do you think more people should try, especially people that are suffering from treatment-resistant depression or other things, or struggling in their lives, should try things like psilocybin, which is the active compound in magic mushrooms?
Generally speaking, no. And there's a really important reason for that. So all these things, so the number of people who have been, that I've seen in my office who have been messed up by psychedelics far outweighs the number of people who've been helped.
Really?
Yes. So LSD, we know this, right? There's bad trips with LSD. It lives in your spine. You have like LSD flashbacks. I've seen PTSD from trips. I've seen new anxiety disorders, panic disorders from psychedelic substances induced. So these are people that'll come to me like, I'm 32 years old. I was fine for my whole life. 6 months ago, I used psychedelics and now like I'm having panic attacks. Here's the key thing to understand. Psychedelics, what we know scientifically, forget about whether the beings exist or not, whatever, Dr. K's crazy. What we know is that they induce neuroplasticity. Now, here's the problem. Neuroplasticity means my brain is in edit mode, okay? Which means that if you edit it in the wrong way, you'll mess up your brain. So what we know is that this is what's really interesting. If we look at the therapeutic effects of psychedelics, set and setting matter a lot. You need to have like people with you who can like shepherd you through the journey, because if you just do it on your own, you'll potentially get worse. All of those negative whatever emotions or whatever with the psychedelic experience and neuroplasticity, you'll sometimes get, people will call it, I forget, it's called the heroic dose, right? So there's some guy who kind of coined that term. So a super high dose, which will activate your nervous system in a potentially traumatic way. So if you look at the history of psychedelics, the way that they've been used, you're helped by like a shaman.
Yeah.
Right? So there's someone who knows how to like do it in a way that is positive. And unfortunately, what I've seen is I've had plenty of patients who will like experiment with it when they're feeling really bad because they hear it as healing.